Hi, I'm Dr. Steve Taubman, best-selling author of Bulletproof and the co-founder, along with Dr. Tim Warren, of the Ouch Doctors. If you're one of the 60 million people that are suffering from chronic pain, there's a piece of information, the lack of which has caused untold suffering, the reason that chronic pain exists. I've made this little video for you. I hope you enjoy it. If you do, I'd like to encourage you to reach out to us for a free consultation. We'll let you know about the various options of how to work with us and which one would be best for you. If you're a chronic pain sufferer, you're not only bearing the physical pain, but you're watching as your life slips away, avoiding activities you love, golf, tennis, running, playing with your kids, enjoying your vacation, or even sex, not to mention focusing effectively at work. You're probably also living in fear of your next episode of pain, scared to move, bend, twist, or even sometimes just breathe. Top that with the stigma of disbelief. Unlike most other illnesses, your pain is invisible to those around you, causing others to speculate about its legitimacy. You may be branded as a malingerer, lazy, emotionally unbalanced, or too caught up in yourself. Even your doctor, who has no answer for you, may still form a silent judgment about the validity of your pain. And that could leave you questioning yourself, wondering if you're just a hypochondriac. You need to recognize that while doctors serve a very important role with regard to illness and disease, they simply don't understand pain. That's not a sacrilegious statement. They freely admit it. Just read the Harvard Health Letters article about the problem of using drugs to treat chronic pain. It's a big problem that's led to financial ruin, opioid addiction, and suicide. Bottom line is that doctors don't treat the cause of pain, they only treat the symptoms. Chronic pain begins in the brain. Nerve pathways in the brain, first formed by some earlier trauma, physical or mental, have been used over and over again until they become a well-worn pathway. You end up with pain brain. Once you understand that your pain originates in your brain, not your body, you'll start to heal, to feel better, and to live again. If this seems implausible, consider this. There is a phenomenon called phantom limb pain. People who have lost an arm or a leg often report significant pain in the limb that no longer exists. We're not saying that the pain is all in your head. We're saying it starts in your brain. That your brain produces a set of sensations and that it also reacts to those sensations by changing and restricting blood flow in the body. This means less oxygen reaches the body parts, and that creates muscle spasm, tension, inflammation, and irritation of the peripheral nerves. This secondary bodily response to a mental process is actually something with which you're already quite familiar. When something scares you, your blood pressure goes up, your pulse rate increases, blood flow changes, and you experience temporary discomfort. Chronic pain is no different, a bodily reaction to a neurological, psychological experience. This is called neurogenic or psychogenic pain. You may still cling to the idea that your pain is physical, that the pain in your back is coming from your back, or maybe you believe that some old injury is the reason you're still hurting. This is quite literally impossible. Once a body part heals, there should be no pain. That means that any pain lasting more than 6 to 8 weeks is not tissue generated. It's not that part of your body, period. Until you realize this and treat the true cause of pain, you're destined to suffer from the pain and from the treatment itself. We don't want to see that happen to you. It's time to get rid of your pain and start living again. Imagine living your life energetic, free, and happy with a smile on your face, working effortlessly, playing with your kids, enjoying your love life, taking a run, getting yourself through a whole game of tennis, and even bowling with no fear of repercussions. Now that you know this, let's get started. Let's join hands and get you back to your old self now. You've got a lot of living to do.